In the today's topic, we will be discussing the causative agent of influenza, explain the structure of influenza virus. We will also discuss the transmission of the influenza virus, and we will also be discussing symptoms, treatment, and prevention of influenza virus. So, influenza is basically the disease caused by the influenza virus. The influenza is basically an acute infection which occurs for a shorter period of time into the humans or the animals, and it is a contagious disease, so it can be transferred from the one person to another person, and even from the animals to the humans as well. It's basically the infection of the upper respiratory tract. If we anatomically divide the respiratory tract, we can divide it into the upper respiratory tract and the lower respiratory tract. The lower respiratory tract includes the trachea, the alveoli, and bronchial tree, while the upper respiratory tract includes the nose, nasal cavity, and some parts of the esophagus as well. So influenza basically is a viral disease that is caused by the influenza virus. It's an acute infection that occurs for a shorter period of time, for about 7 to 10 days, and it's a contagious disease that means it can be transferred from one person to another person, and it can also be caused or transferred from the animals to the humans as well. It's the infection of the upper respiratory tract. Basically, the respiratory tract can be divided into the upper and the lower parts. The lower part of the respiratory tract include the trachea, the alveoli, and the bronchi, while the upper respiratory tract includes the nasal openings, nasal cavity, and nasopharynx area. Over here, we are discussing the various characteristics of the influenza virus. The infection caused by the influenza virus is called as the influenza or flu. The influenza or flu is different from the cold. The causative agent of the influenza or flu is the virus. However, the cold occurs because of the various environmental factors. The influenza virus belongs to the Orthomyxoviridae family, and its structure includes 8 small single-stranded segments of the RNA that are antisense. Normally, the nucleic acid is present as a single continuous strand. However, into the influenza virus, the RNA is present as 8 separate single parts or strands of the RNA. The nucleic acid is in the form of a helical nucleocapsid. As you see into the diagram, the nucleic acid material is into the helical form because of the helical nucleocapsid shape. This is a enveloped virus. As you know that the viruses which are causing infections into the animals are coming out of the cell along with the cell membrane parts, and this virus contains certain proteins onto its surface. The major proteins onto the surface include the hematogluten, which is basically involved into the binding of the virus with the animal cell membrane. It forms complex with the receptor sites onto the animal cell membrane, and then through the process of the endocytosis process, the virus is going into the animal cell. The other important protein present onto the membrane is the neuroamidase. The neuroamidase helps out the virus coming out of the animal cell after the transcription and assembling process has been carried out. The third important protein present onto the viral envelope is the ionic channel, which is basically an M2 protein. It helps the influx of the hydrogen ions. As a result of those hydrogen ions influx, there is change into the pH, and as a result, the dissolution of the capsid take place, and then the nucleic acid can go into the nucleus of the cell for the further replication process. Here in this diagram, in the bottom side, you can see there is the cell membrane of the animal cell, which is a lipid bilayer, and onto that there are various proteins present. One of those proteins structure present is the sialic acid. The hematoglutinin protein that is present onto the surface of the virus basically binds with this sialic acids, and as a result of this receptor and binding side integration, there is change into the membrane of the animal cell, and as a result of that, through the process of the endocytosis, the virus goes into the cell for the further processes. As discussed earlier, there are various proteins that are present onto the surface of the influenza virus. One of those important proteins is the hematoglutinin, which we discussed that it is helping into the binding of the virus with the cell membrane. These subunits are into the larger quantity and present in the number of 500 onto the each virus. They are responsible for the pathogenicity of the virus because they are helping the virus to adhere to the endothelial cells of the respiratory tract, and these are also the main determinants of the immunity as well. Another important protein that is present onto the surface of the influenza virus is the neuroamidase. These are also into the spikes form, but these are less in number as compared to the hematoglutinin. Their count is about 100, and these help the release of the virus from the cell when there is completion of the transcription and assembling of the virus. And this protein is determinant of the disease severity, because if the virus will not release out of the cell, there will be less chances of the infection, and if this protein is working efficiently, there will be more release of the viruses from the cell. They will infect more cells, and the chances of the infection will be more. The third important category of the proteins are the M2 proteins. These are basically the ion channels. These ion channels help the influx of the hydrogen ions inside the virus. This virus needs the acidic pH for the dissolution of the capsid, so that the nucleic acid can be released and go into the nucleic acid for the further replication process. So by the activation of these ion channels, the hydrogen ions are going into the virus that will change the pH, and as a result of that, the nucleocapsid dissolves and the nucleic acid is released. Another important characteristic of the influenza virus is the antigenic variations. These viruses have capability to change themselves with the time to cope up with the external environmental factors that are inhibiting their growth. The basic components of the protein of the virus that are involved into this antigenic variation are the hematoglutinin and the neuroamidase. The variations at these sites can affect the action of the drugs or different immune substances produced by the human body, and as a result of that, these drugs or the human immune system components cannot affect the virus, and as a result, the viral infection will be more prevalent. Furthermore, these antigenic variations can be categorized into the genetic drift and genetic shift. Into the genetic drift, there is variation into the composition of the virus, but these are very tiny mutations. Sometimes they may affect the severity of the infection and sometimes may not. However, into the genetic shift, there is a major change into the composition of the virus, and that may affect the severity of the disease. So based on to the composition of the viruses, based on to the genetic mutations, the the influenza virus can be categorized into the influenza A, influenza B, and influenza C. The influenza A virus is highly infective and causes severe type of the diseases. This virus not only causes the infection into the humans, but it can also affect other animals as well. The infection caused by this virus and its spread is so much severe that the disease may convert from an epidemic to a pandemic and can affect a large population. The influenza virus is also capable of producing a severe disease, but it only causes the infections into the humans. And its spread is also relatively controlled as compared to the influenza A virus. One of the factor of the larger spread of the influenza A virus is that it's not only spread through the human contact from one person to another person, as it is also occurs into the animals. The disease can be transferred from the animals to the humans as well, as you have might heard into the past that various diseases or flus were transferred from the chickens and the ducks to the human beings. The third type of the influenza virus is the influenza C, which is a mild type of the infection, and it can mostly affect the humans, but in some situations it has also been observed that it is causing infection into the pigs. This type of the virus does not has capability to cause severe infections, so there are less chances of the epidemics with the influenza C. So next is the transmission of the influenza infection. So the transmission of the influenza infection can occur through the coughing or sneezing, because during the coughing and sneezing there are chances that the droplets from the respiratory tract and mouth and saliva can move from one place to another place, and then another human being can come in contact with those particles containing the virus, and the infection will be transferred from one person to another person. In other situations, it can also occur through the direct transfer, like one person is having the infection, he's having sneezing, he touches his nose, and then handshakes with another person, so the infection can also be transferred in this manner. The symptoms of the flu or the influenza includes the sudden chills that the person will be having, shivering. The one of the severe characteristics is the presence of the fatigueness, headache. The person may feel pain into the chest and into the legs as well. The other important characteristic of the influenza infection is that the person may have temperature over a period of 24 hours, and that the temperature can rise up to 104 degrees centigrade. Along with that, the person will have severe cough, nasal congestion and dry throat as well. This diagram further explains that the how this infection is affecting the different parts of the human body. As into this diagram, you can see that the infection can affect the central nervous system, causing the headache. It can affect other systematic problems like the fever into the patient, which is usually high. It can affect the muscles. The person will feel extreme tiredness. There will be pain into the joints as well. Furthermore, there will be gastric disturbance, and because of that the person may feel vomiting. Because of the congestion or problem into the respiratory tract, the person will be having coughing. Because of the problems at the nasopharynx, the person will be having runny or stuffy nose. There will be sore throat, itching into the throat, and there will be aches into the nasopharynx area as well. So as discussed earlier, this is a acute infection, and the symptoms will occur for at least 1 week to 10 days, and then the infection will be self-controlled through the immune system. However, in some situations we don't need to give the any kind of the treatment because the disease is self-controlling. However, in some certain situations we have to give medicines for the treatment of the infection. Like if the patient is already of having asthma or COPD, his respiratory system will be already compromised. So in case if he is having influenza or respiratory infection, that will complicate his asthma. So in these situations we have to critically observe the patient and control the influenza as soon as possible by giving the medications. Furthermore, in some situations, because of the viral infection, the lungs are more prone to be infected by the other organisms like the bacteria. Like Staphylococcus or Haemophilus influenzae bacteria can infect the uh, respiratory system and cause further complications. So if there are more complications, we have to give proper treatment for the early management of the influenza symptoms. The diagnosis of the influenza virus infection includes the observation of the disease symptoms. Through the disease symptoms, we can identify that whether the person is having an influenza infection or not. And for the further confirmation of the disease, we can carry out the laboratory isolation of the virus through taking the samples of the sputum or the saliva, grow them into the laboratory, and through the PCR we can determine that which virus is causing the infection. As with the other contagious infections, we have to be very careful that the infection should not transfer to the other population. So the person who is having the influenza infection should cover their nose and mouth when they are coughing or sneezing. They should wash their hands frequently or use the sanitizer before contacting before coming in contact with the other person. And persons who are having frequent influenza infection can go for the influenza A and influenza B vaccination, which is available into the market. So as told earlier, the influenza is a self-limiting infection that can the symptoms of which can be automatically controlled within 7 to 10 days. However, in severe situations, we can give medications, and these medications are targeting different proteins that are present on the surface of the virus. We discussed about the three type of the proteins that are present on the surface of the virus. Number one is the hemagglutinin, second is the neuraminidase, and third is the M2 proteins. At this time, we have developed drugs that can affect the neuraminidase and M2 proteins. The drugs which are affecting the neuraminidase include the oseltamivir, that is given PO, that means per orally through the oral route. Then we have zanamivir that can be given through inhalation. Then we have peramivir, which is an investigational drug. It can be given through orally or through the intravenous route. So as discussed earlier, that the role of the neuraminidase is the release of the virus from the cell. If there is no cell, there will be no spread of the infection. So basically these drugs block this enzyme or this protein. As a result of that, this protein will not be functional and there will be no release of the virus from the cell, so there will be no spread of the disease to the further cells. The other category of the drugs that are affecting the M2 protein are the amantadine and remantadine. These are also given through the oral route. As discussed earlier, the M2 proteins are involved into the ion channel influx of the hydrogen ions. As a result of that, there is change to the pH and there is resolution of the capsid. So if we block this protein, there will be no influx of the hydrogen ions and there will be no release or dissolution of the nucleocapsid and release of the nucleic acid. So there is further elaboration of the mechanism of action of the amantadine and remantadine, that how these are affecting the viral replication process. So they will affect the M2 protein. There will be no influx of the hydrogen ions. There will be no release of the RNA transcription, and there will be no composition or assembling of the viruses. This diagram further elaborates the drugs which are affecting the neuraminidase inhibition. The drug is oseltamivir and zanamivir. These are binding with this protein. As a result of binding of this protein, the protein is deactivated and the release of the virus from the cell is inhibited, so the severity of the infection is controlled. So as discussed earlier, there is difference into the flu and the cold. The flu is basically because of the virus, and the cold is because of the external environmental factors like the changes into the weather. Furthermore, there is a variation into the signs and symptoms of the flu and cold as well. And during the diagnosis, we have to differentiate in between the flu and the cold. So if we talk about the symptoms, the symptom of the fever is characteristically present into the flu, and the temperature might rise to the 100 to 103 degrees centigrade and may last for 3 to 4 days. However, the chances of the rise into the temperature in cold are very rare. The patients who are having flu are having the prominent headache. However, the symptoms of the headache are very rare into the cold. Furthermore, if we talk about the general aches or the body pains, there is very usual pain and often severe pain into the flu. However, there is very slight pain into the cold. If we talk about the fatigueness and the fatigueness and the weakness may persist for 2 to 3 weeks in flu. However, if we are saying that the symptoms are persisting mostly for 7 to 10 days, the fatigueness and weakness may persist for 2 to 3 weeks. Furthermore, if we talk about the cold, the fatigueness and weakness is very mild into the cold. If we talk about the extreme exhaustion, the person may feel extreme exhaustion into the early and days of the flu, and it is very prominent. However, there is no exhaustion during the cold. Furthermore, if we talk about the stuffy nose, sneezing, and sore throat, there is sometimes of the chances of these three symptoms. However, the stuffy nose, sneezing, and sore throat are very common into the cold. If we talk about the chest discomfort is also very common and can be become severe. However, the chest discomfort into the cold is very mild to moderate. Furthermore, if we talk about the complications, the flu can cause many complications and which may lead to the death as well. The complications associated with the flu are the bronchitis and the pneumonia. As we said, that if the person is very asthmatic, it can be very problematic. The flu can be very problematic, and if the person is having flu and along with that he is having any bacterial infection, bacterial respiratory infections, the complications may be life-threatening as well. However, into the cold, there is only sinus congestion or there is only earache. There are no further complications. To the prevention, we have to be very careful that the infection cannot be transferred to the other persons, and persons who are having frequent influenza infection can go for the annual vaccination as well. Furthermore, if the infection is severe, we have to use the antiviral drugs as well. Into the cold, we do not have any specific drugs or the vaccination process can be carried out. Furthermore, for the treatment, in the flu, we have antiviral drugs which should be used within 24 to 48 hours if there are requirements of the use. While into the treatment of the cold, there is only temporary relief of the symptoms by giving certain drugs which will be relieving the symptoms. We cannot prescribe a specific drug for the treatment of the cold.